office in gynaecology, and he has been educated so many gynecologists in the city and throughout India. And we had a surgery for Professor Dr. Srivalsan, and all the details will be discussed by the doctor itself and Dr. Bashi and his team. And I would like to welcome all the press and media and his family members who have accepted for this program. Thank you, sir.
I want to welcome you, all of you, coming this morning, taking your valuable time in attending this meeting. And I must thank Dr. Srivalsan and Dr. Anu, his son. He is also a senior gynecologist, having accepted our invitation to come and attend this meeting. In fact, when I asked him whether he can come, he said, I want to come. Then I asked him, why you want to come? No, because after surgery you are just recovering only. But he said, I want to let the public know that age is only a number today. So when he had this chest discomfort, he went to his cardiologist because then they diagnosed heart block, whereby the heartbeat will be less. As you grow older, the natural pacemaker on the heart will slows down, it gets diseased. So it is called the sick sinus syndrome, where the sinus node which gives the electrical impulse to the heart becomes sick due to the age. So they need a pacemaker implantation, that is the treatment. So usually, especially in older people with the borderline diabetes, we always do a coronary angiogram also, because he had chest discomfort. Then we found he had 4-vessel block in the heart. Now the question was whether to do an operation or continue medical treatment or do an angioplasty. So angioplasty technically is difficult, especially in older people with the calcium in the arteries. So the best option was a bypass surgery and with the pacemaker implantation. So when we told him about the requirement of that, he said, whatever you say, I will decide. I will accept because I know the advantage I am going to get. Only thing I am worried is about the pain. So I told him, don't worry about the pain. We make sure that you will not have any pain after the operation. So he will tell the rest of his post-operative course. But why I chose this case to present in the press is to get the people to know about the treatment available for heart disease today. And age is not at all a barrier in treating, provided the patients are willing. Because many times we, as senior experienced doctors and physicians, advise a procedure. Today what happens, they will ask about 10-20 people, go through the WhatsApp information, WhatsApp doctor I call, and then they don't get the correct treatment. Each fellow will have a negative opinion that if you do like this, this will happen. Nobody will say, okay, you undergo this procedure, this is advantageous for you. So if anybody listens to a proper advice, only the beneficiary is the patient. You are the beneficiary. So in today's world, with so many, because I started cardiac surgery in 1977, when it was, the surgery was a very, very rare thing. In all India itself, there will be 2 or 3 centers doing open heart surgery. Now the surgical procedures, especially bypass surgery, has advanced so much. I am fortunate to see the development which has happened, because olden days when bypass surgery, you have to stop the heart and use the heart-lung machine, take long hours. The results also were very poor. At least if you operate 100 patients, 25 patients used to die those days. Today, with the developments of technology and our experience with doing these procedures, a patient dying after bypass surgery is a news. Olden times, it was a patient surviving was a very big news. So much we have advanced, and especially in his case, especially older people, when we do the operation without stopping the heart, it's a big advantage because they may have, as you grow older, as you know, heart is not the only organ which becomes old. Your kidneys are old, your brain is old, your liver, all the systems are older. So they can have associated problems like sometimes you have liver dysfunction, kidney dysfunction, blocks in the blood vessels going to the brain, into the blood vessels in the leg. All those are possibilities. So they have. Okay. So adinala multiple problems ulla patient beating heart surgery is best. Number one treatment is beating heart surgery. அது பண்ணுறோன்னா நிறைய யூ ஹேவ் லாட் ஆஃப் எக்ஸ்பீரியன்ஸ் தேவைப்படும். ஏன்னா ஹார்ட் நிறுத்தாமல் பண்ணுறதுக்கு சில டைமில் பிபி லோ ஆகிடலாம், இல்லைன்னா கிட்னி ஃபெயிலியர் வரலாம், நிறைய காம்ப்ளிகேஷன் வரலாம். அது ஹார்ட்லைன் மெஷினில் பண்ணிட்டேன். ஸோ அதில் பீட்டிங் ஹார்ட் சர்ஜரி பண்ணிவிட்டு வேறு பிரெயினில் ப்ராப்ளம் வராது, கிட்னியில் ப்ராப்ளம் வராது, லங்ஸில் ப்ராப்ளம் வராது. எல்லாரும் பேஷண்ட்க்கு அட்வான்டேஜ் தான். பெயின் எடுத்துகிட்டு இது கனெக்ட் பண்ணி இங்கே பிளாக் இருந்துட்டு அயோர்டாயில் கனெக்ட் பண்ணிவிட்டு பைபாஸ் பண்ணுவோம். இதுதானே பைபாஸ் பண்ணுறது. ஹார்ட்டு பீட் பண்ணும்போது இங்கே இது 2 மில்லிமீட்டர் தான் இதுக்கு இது சைஸ் இருக்குது இந்த ரத்தப்படையில். அது ஹார்ட்டு நிறுத்தாமல் பண்ணுறதுக்கு டெக்னிக்கலி கொஞ்சம் டிஃபிகல்ட்டு தான். நாங்கள் வந்து லாஸ்ட் 25 இயர்ஸ் ஐம் டூயிங் பீட்டிங் ஹார்ட் சர்ஜரி. மோர் தென் 15,000 பைபாஸ் பண்ணியிருக்குது பீட்டிங் ஹார்ட்டில் வித் சக்ஸஸ் ரேட் ஆஃப் மோர் தென் 99%. So that is the reason I thought I will in the case present பண்ணுறதுக்கு காரணம் அதுதான். ஜஸ்ட் மல்டிபிள் ப்ராப்ளம் ஓல்ட் ஏஜில் வரும்போது கூட இஃப் யூ ஹேவ் நம்ம வில்லிங்கான ட்ரீட்மெண்ட் எடுத்துகிட்டு அவங்களுக்கு தான் அது ட்ரீட்மெண்ட் எடுக்கிற பேஷண்ட்டுக்கு தான் பிரயோஜனம். அது தெரிஞ்சிருக்கணும். அண்ட் பப்ளிக் ஷுட் நோ அபவுட் இட். தட் இஸ் வாட் ஐ ஹேவ் டு டெல். அண்ட் ஃபார் ஹிம் வேறு ஒரு பிரச்சனையும் இல்லை. ஆப்ரேஷன் பண்ணிவிட்டு நெக்ஸ்ட் டே வெண்டிலேட்டர்லாம் எடுத்தாச்சு, 3rd day பேஸ்மேக்கர் பண்ணியாச்சு, 7th day அவர் வீட்டுக்கு போயிட்டு இப்போ அவர் ஃபஸ்ட்டு செக்கப்புக்காக வந்துருக்குது 7 daysல. ஸோ இஸ் ஒன் ஆஃப் தி சீனியர் மோஸ்ட் gynaecologist alive இப்போ சென்னையில். அவருடைய சன் ஆல்சோ வெரி ஃபேமஸ் டாக்டர் அனூப். They are all very supportive. He has got another son who is an engineer. Advocate, yeah. He is there only. So family support ever since அவர் வந்த உடனே நான் ஆப்ரேஷன் வேணும்னு சொல்லிவிட 2 பேரும் சொன்னார், டாக்டர் என்ன வேணும் நீங்கள் பண்ணுவீங்க, 100% we are willing. Then I told காம்ப்ளிகேஷன் வரலாம், ஓல்டேஜஸ் வரலாம், ஸ்ட்ரோக் வரலாம், கிட்னி ஃபெயிலியர் வரலாம், நிமோனியா வரலாம், wound இன்ஃபெக்ஷன் வரலாம், எது வந்தாலும் பிரச்சனை இல்லை. We have heard so much about the hospital and your team. Whatever best for him, நீங்கள் பண்ணிடுங்க. அதனால தான்
I am Dr. E.C. Srivalsan, Professor of Obstetrics and Gynecology, retired from Madras Medical College in 1991. I have served for 30 years in the government of Tamil Nadu, but now as a pensioner, I am already past 34 years. Now, till 4 months ago, I was absolutely normal. Then I had.
Sir, Tamil பேசுறீங்களா?
I'll talk in English. At the end, if anybody was any.
4 months.
So, I came to Dr. Bashi because my cardiologist advised that he is the right person to tackle my problem. 4 months ago, I had a little ischemia of the heart, I should say, because I was damn pain. When I was giving a talk in a local college, I told the person, I cannot proceed, we will stop. Then it turned out to be, I had a partial heart block. Within 2 weeks, it had become a complete heart block. Then I consulted my colleague and cardiologist, Dr. Tirumalai, at AG Hospital, Tambra. He said, nothing to worry, we'll set it right, we'll put in a pacemaker or something like that. It's all beyond my knowledge. Then when he did it, he found there were 3 blocks, or about 90%. Then he said, sir, I don't think we can tackle it here. I will refer you to Dr. Bashi. So I came and met Dr. Bashi. He said, we'll do it, nothing to worry. I said, I have one condition. I should not feel pain. Because I thought I cannot bear pain. That was the situation. He said, don't worry, we will. Today, I can boldly say, surgery and post-operative period, I have not had a single pain, thanks to Dr. Bash.